All right, I'm recording now. Um, you guys want to hop into it right away?
Yeah, sure.
All right, Kyra, are you ready?
Yeah.
Give me a second. All right. Everyone should have their own, I guess, like timer, so that they know what the timing is. If anyone does not know the time, just put it in the chat, and I'll hold my phone up. And POIs can just be said by, I guess, unmuting and announcing the POI.
Mind timing for me?
I time for you.
Yeah.
And I'll just hold it up like this. Okay. Wait, Kyra, would you prefer POIs like be sent in chat or like they just like interrupt you?
In the chat, I guess.
Okay. So for Kyra, just put them in the chat.
Oh wait, no, actually, I'll just unmute and say it.
Okay. All right. Are you guys ready? Okay, we can begin.
Okay. Just start, yeah. Imagine the world in total chaos, with so many dying and infected by an unknown disease that countries are unable to keep up with the pressure on their healthcare systems. Now look outside your window, because you don't have to imagine it. This is our world today. The world is in disarray and chaos, struggling to uproot a defense in the fight against the global enemy, which is the COVID-19 pandemic. In short, as we have observed with the recent pandemic, when countries are left to formulate their own pandemic plans, they are made considering what is best for them at the forefront, not what is best for the world as a whole. And this can be a counterproductive approach. For example, in the beginning, some countries opposed lockdown with their economies in mind, aiming for herd immunity. Others imposed lockdown almost immediately. The countries that did not take the initiative of lockdown allowed the virus to spread internationally. While the latter was a more coordinated approach to the issue, where most countries decided on international lockdown, it was too little too late. Countries should have been in agreement of a base safety standard from the start, so they can focus on themselves and not worry about what the rest of the world is doing. Today, that proposition will prove that a centralized health agency, such as the World Health Organization, or WHO, should lead the response to global pandemics rather than individual governments in order to avoid such a chaotic outcome. Now, ultimately, in this debate, side opposition has the burden to prove that their solution is the most effective method of controlling the spread of virus, and will provide the most benefit.
Point of information.
We will define leading response as coordinating and putting forward a set of guidelines that member nations will implement and follow in response to a pandemic situation. The problem that we are debating is the problem that we are addressing is the inadequate response to global pandemics, which result in disorder within communities and healthcare systems. The stakeholders in this debate are the countries and their citizens affected by the pandemic. Today's side proposition is going to present to you three key arguments to support our stance. Number one, the WHO provides a standardized response to a pandemic. Number two, the WHO prioritizes healthcare above all else. And number three, the WHO provides equality. Now on to my first substantive. The thesis of this argument is that the WHO will be able to provide a standardized pandemic response to the world due to its unique position and globalized perspective. So why is the WHO a uniquely positioned agency? It has one central goal which connects them to the rest of the globe: good health for all people. Being a branch of the United Nations,
Point of information.
It has 19 member states that support and contribute to its database and decision-making. This provides it with an international perspective which is backed up by the extensive and accurate data they receive from every country. This, coupled with its common goal, puts it in a position that gives it the ability to provide a set of guidelines for a pandemic response that is beneficial not only to individual countries, but to the world as a whole. So why is a response like this only available from a centralized health agency like the WHO? This global perspective that the WHO possesses is something that individual nations do not possess. They operate with the data that is relevant to the situation of the pandemic in their specific country. This results in a narrow-minded perspective of what the full extent of the situation really is. This narrow-mindedness could lead to countries making decisions that benefit themselves, but not the world as a whole. Therefore, a centralized health agency is the best candidate to provide a set of solutions like this, thanks to the WHO's global mindset and support from its 97 member nations, as well as its extensive database. It is at a position which is best suited to take the position of that centralized health agency. I will now take a point of information.
The WHO initially, in the leading date up to the coronavirus outbreak and when it's first being discovered, actively discouraged people from wearing masks.
So the WHO, as I've said, it collects data which is meant to be the most relevant and accurate. To do this, a hasty response might not be the most effective solution. They need to have all the necessary information provided to put forth the safety guidelines that the countries must implement. Now moving on to my second substantive. The thesis of our next argument is that the WHO prioritizes worldwide healthcare as their main goal and can therefore use all their resources and knowledge to work towards it. This primary focus allows them to collect data that is relevant to the problem at hand. Since the WHO's main job is to promote international healthcare, it has the facilities best suited to be in charge of a global pandemic response, due to the simple fact that all the resources are available to use for problems exactly like this one. For example, in the beginnings of the pandemic, going back as far as December of 2019, the WHO had employed its experts in various fields such as virology and infection prevention and control, all of which are specific to a pandemic response, to gather their knowledge and specific information that they use to fight it. This could also add to the POI, which was presented to me. They need this information before they can take appropriate measures. And they do this in a way that is effective and extremely thorough. Now moving on to why individual governments cannot prioritize healthcare as their priority. Individual governments prioritizing healthcare as the only issue that they will spend the majority of their time and money on is not feasible for countries. The responsibility that they hold to their country and citizens in terms of social, political, and economic issues cannot be trumped by this one healthcare issue. And it could prevent them from making tough decisions that are the best step in terms of healthcare, but not for other aspects. We saw this play out just last year, with countries delaying their lockdown to avoid issues such as economic recession. This is why we argue that the WHO, with its main focus and area of expertise being healthcare, is a better positioned agency than individual governments fighting a global pandemic. Thank you.
Speaker spoke for 6 minutes and 8 seconds. We will now invite the first speaker of side opposition up to the podium, I guess, to give their speech. You may begin when ready.
Before I begin, this is a mic test. If anyone can't hear me clearly, please let me know. If not, I'll begin my speech shortly. Okay, then I'll begin my speech in 3, 2, 1. Don't count your genomes until they've hatched into a fully fledged virus. This is a pandemic we are talking about, people. Pandemics spread very quickly, very widely. Now let's begin by discussing what site proposition has failed to actually define. Pandemics we're not talking about a declaration of a pandemic, but instead of illnesses that are widespread across multiple countries, multiple continents, and of which that affects a large portion of the population, and as what is defined by epidemiologists. So with that being said, in the status quo, even now while we're living in a COVID-19 reality, the World Health Organization, WHO, is only present to present guidelines as an advisor to different countries, which we agree on, and instead of actually commanding and leading countries at the forefront of combating pandemics. Now, for let's start with saying that site proposition has failed to actually address the motion correctly by saying that the response to global pandemics should be led by the World Health Organization, by saying that the World Health Organization should only be there to propose guidelines is not actually fulfilling the motion, as they have to say that the World Health Organization will take charge of global pandemic efforts instead of just providing guidelines, because there is no one who's going to be there to enforce them, which is what site proposition has to fight for. So for our side, we would rather have the WHO remain in a role that advises countries on what to do, as in the status quo, instead of taking over the reins from individual governments. This would mean that countries and their own governments have the last say in what they will do for their countries, and the WHO would have to defer action in individual countries until their government agrees to the action. The side that ultimately takes this debate is the side that better protects the people as a whole and better mitigates the effects of the global pandemics. In today's debate, I will be talking about how having individual governments take charge of their own pandemic efforts would lead to increased effectiveness when dealing with such pandemics. And my second speaker will be talking about how this protects the autonomy of countries. Before I move on to my substantives, I would like to deal some strategic attacks. Following on propositions for substantive, when they said that having the WHO would provide a standardized response, that is seeing even in the world we're living in right now, that is simply not true, because the WHO has given out a delayed response, which is when my second speaker gave a POI about the WHO giving misinformation about wearing masks. She said that it is better to have a delayed response than a hasty response, which is not true, because in the pandemic, time is precious, which I will touch on in my first substantive. And the WHO regarding the coronavirus situation has delayed a total of 3 months from when the virus was discovered in Wuhan, even with continuous warnings and efforts from different countries. So they are not giving out a standardized, centralized response. And in fact, individual countries had to come forward first and protect their own countries before the WHO actually thought about stepping in. Now, tackling their second substantive about how governments don't actually have the resources to prioritize healthcare. This is also simply not true, because to the government, the health of the people is fundamental. Their economy must be there, but who is going to be active in the economy when everyone is falling sick around them? So it is their priority to meet the safety of their people first. And the WHO, yes, they are caring about their health, but then by saying that governments don't prioritize health on the same level as the WHO does, they are discrediting the efforts of governments entirely. So moving on to my first substantive on how having individual governments would lead to an increased effectiveness on battling the pandemic. With faster response timings that are more appropriate in terms of the context presented to countries, efficiency of dealing with pandemics will greatly increase, which would lead to a safer and arguably more sterile environment for people to live in. They would worry
POI.
less about getting sick. Before I move on, I will take that POI. Thank you.
So by this logic, would your side also be for each individual state within a country also making their own pandemic plan and following that instead of a federal plan?
Now, here's the thing. By definition, a state is actually interchangeable with the word country. So yes, a country, I'm assuming that you're saying that places like United States of America, where they actually have their own governments alongside the main federal government. So here's your answer. So with the WHO being a large-scale international organization, there will be delays when responding to a pandemic for sure, as the WHO is required to take into account the state of the world before taking action, as their words and statements carry a heavy weight that most countries will consider. These delays are not what you want when facing illnesses that very easily infect people, such as in the case of Ebola, severe acute respiratory syndrome, and the very familiar 2019 NCOV. With individual governments spearheading their efforts in combating pandemics, they'll be able to better handle these countries with finesse and greater attention to detail, as the governments of these countries would know in terms of which countries, in terms of political, geographical, and relations to look out for and be more flexible in their approach in dealing with pandemic. Take the example of Taiwan in 2020. Even 2 months before HWO got their bearings and declared COVID-19 as a global pandemic, Taiwan was having health officials screening passengers on flights for fever and symptoms of pneumonia, enabling them to tightly secure a bottleneck to reduce their local transmissions. And because having individual governments spearhead the efforts of their own pandemic crisis, please side with side opposition. Thank you.
Speaker spoke for 6 minutes and 12 seconds. We will now be inviting the second speaker from side proposition to deliver his speech.
As a side note, my name is Dylan, not Mickey. My student account's like messed up. All right. Before I begin with my speech, I would like to start with some rebuttals. Firstly, the side opposition's first speaker talked about how the WHO gave the delayed response. However, they only gave the delayed response because they did not have enough information to make accurate reasoning. They did not have enough information to make accurate choices. And that's because the Chinese government was not able to provide this information. They waited 3 weeks to even allow a WHO scientist to go to China and research. They waited multiple weeks before even admitting that it was the virus was able to be contracted human to human. And that is because the WHO has no legal ground in the status quo. The WHO has no power to force these countries to give them this information. The countries can do whatever they want with the WHO guidelines, meaning that no matter what, if they do not have this information, they cannot make the guidelines. But the only reason why they don't have the information is because the governments of individual countries are not subjected to give it. Moving on. The side opposition's first speaker responded to our POI, saying that they do believe that individual state governments should be allowed to make individual pandemic response plans. However, if we look back in history, this simply does not work. Having 50 states of a single country working out of unison, completely autonomous from one another, does not work. It's uncoordinated. It's nearly chaotic, as each has one plan. And within one state, there are no borders. One can cross from one border to the next, from one state to another, without anything. They simply cross a road. There's no checkpoint whatsoever. Meaning if one state is in complete lockdown and one is not, what is stopping the one from one state going to the other, bringing in that virus? Because that one state did not have any quarantine. They did not have any masks. They had nothing. So then what even is the point of that one state going through all of those guidelines and laws if the one state is just going to let it go? There's no point. And that is why that individual states cannot have individual pandemic plans. And by that logic, that means that individual countries cannot have individual pandemic response plans. Instead, it is imperative that there is a global coordinated response led by the WHO. Moving on, the side opposition's first speaker in her first substantive talked about how if individual governments had their own pandemic plan, it will be more effective. However, once again, this is simply not true. Because within one individual nation, they simply do not have the power to be coordinated enough to make a quick response. Yes, within one nation, there is less bureaucracy. Yes, they do have the ability to make quicker responses. However, this does not mean having quicker laws and responses does not mean that it'll be more effective of controlling the virus. Because what is stopping when there's an uncoordinated response time? As soon as they stop with their quarantine, as soon as they stop with whatever provisions that happen within that one country, what is stopping someone from the next nation that had absolutely no guidelines coming into that country and bringing in that virus? It simply prolongs the virus. It simply stops this malignant virus from continuing from the COVID-19 to any virus in the future. And this is why throughout history, in every single pandemic, it has been absolutely
Point of information.
brutal. It's been absolutely brutal because there have been no global responses. I'll now take your POI.
Do you think that the UN should take over North Korea, seeing as how it's run by a dictatorship?
Well, currently the UN does not the UN does apply sanctions and whatnot to individual countries because they do abide, because they yes, they do. However, we do believe this because that North Korea country is they are subjected to that because they are breaking global they're breaking human rights violations. So moving on to our second substantive. In the beginning of this debate, a burden was set for a team to prove which side benefited the most people. And I'm about to prove why the WHO can benefit the most people because they ensure equality. See, during a pandemic, everyone, regardless from where you live, needs the same basic requirements. Food, cleaning supplies, water, whatnot. And when everyone needs the same things, there's an increase in demand and a diminishing supplies, which will inevitably lead to an increase in price. Just remember back in circuit breaker, when grocery stores were wiped clean, no one could buy what they wanted. And people had to either pay an inflated price or they had to pay a large upfront cost to hoard, leaving people who could not pay this much dead in the water without supplies. And we believe that this is simply wrong because this issue is happening at a global scale where every country needs the same things: face masks, ventilators, testing kits, vaccines, and so on. And just like that, what happened in the grocery store, the same thing happens. There's a limited supply and the increased demand, and the prices go up. And this will lead poorer countries not being able to buy the essential goods that they need for their countries. Companies will always sell their product at the highest price to make the most profit. It's simple. So when multiple countries are fighting over the same product, they begin to offer more money for products, creating a bidding war. And every time the larger, most powerful nations will buy the supplies because they can pay more than the poorer country. As long as there are people left without protection from the virus will continue to spread, which will simply prolong COVID-19 or prolong any other future pandemic. In other words, of the Director General of the WHO, more than 39 million doses of the vaccine have now been administered. Just 25 doses have been given in one lowest income country. Not 25 million, not 25,000, just 25. And for this reason, we believe that the WHO should control not only the distribution of supplies, but a coordinated response to pandemics. And for this reason, I am proud to propose.
Speaker spoke for exactly 6 minutes. We would now like to invite the second speaker of side opposition up to the podium to give his speech. Speaker may speak when ready.
Hi, everyone. Can you hear me? All right. Okay, I'll start my speech now. So onto my rebuttals. So there's a rebuttal on the first substantive, rebuttal on the substantive on ensuring equality on the side of proposition. There's a big problem with this. Even as we talk about today, the WHO is not equal in the way it treats countries, even though it's its mission. So let's give the example for Taiwan. They didn't really exactly treat Taiwan the same way they treated other countries. They even didn't allow it to go for the health summit because China wasn't mad at them. So if they were in greater power, think of how that would affect countries. Think of how much damage that would cause. They aren't even equal in the beginning. If you give them more power, it just makes it seem like you're giving more power to something that's already failing, something irresponsible. So let's assume that they actually do ensure quality. Let's assume that they will be there to front the coordinate resources, move it around, make sure that places which need the resource gets the resources. But the proposition didn't really explain why this is the only way that this could happen. They didn't really explain why governments are incapable for talking to each other and coordinating response kits and medical appliances, medical test kits, because they have a method to do that through, and that's the UN. So given in a perfect situation, in an ideal world where we have good governments, they can also take up this role. Otherwise, what are governments for? Why do we have the UN in the first place? So they need to really explain and why governments aren't capable of doing this at all. It is best case scenario. They also just criticize us on our substantive on, states don't have enough power to coordinate. The global coordinate response is staggered because individual countries can talk with each other, apparently. This is the assumption that they're making. However, this is false. And in their world, it will even actually take a longer time to respond. And here's why. The WHO is a small governing body. They don't have a lot of infrastructure. They don't have a lot of political capital nor manpower to really get all the information in. They don't have the administrative capacity because they are an advisory role. What happens in the end is that it takes time for a data to come trickling in. WHO only has enough processing power. Look at how long it took for them to process the information coming out from China, from countries already. I mean, 3 months delay, right? And on that note too, they said that the WHO gave a delayed response because it didn't have enough information to give accurate, calls, despite the fact that they have real-time data telling them that there is a respiratory disease out there. Wouldn't the
POI,
first
sir.
thought, yes?
Do you think China would have treated Taiwan more fairly than the WHO?
If the WHO is acting in proxy of China, I'd say they're about the same. The point about that is about influence. It's not about whether the WHO would be treating better or not. It's about influence. China, again, is not the WHO, but they do influence the WHO, and we have seen that. Again, so when we say that, they don't have enough research to accurate information about respiratory diseases, but isn't the first thought like, just wear masks? It doesn't really harm your health, and it's a safe precautionary measure for a body that says that health is number one priority. That first thought doesn't even come into mind. So how can we really trust them to do big scale cooperation, big scale coordinated, responses? So I move on to my substantive now. And my substantive is about how the WHO would violate the autonomy of countries. When we see power centralized and built, it becomes a target of manipulation and corruption. We have seen this in most extreme cases in authoritarian dictatorships built on shaking political ground. Create an opportunity, an opening, and there will be people to bust it wide open and take advantage of it. Game theory dictates their moves more than compassion and empathy. Let's appreciate for the moment what leading the pandemic would require. Vast sums of financial resources, manpower, infrastructure. Oh, wait, yes, increased control over all member countries of the WHO. After all, with power comes authority, and when times get tough, order is required for the counter-pandemic plans to be successful. The proposition has echoed this logic. The WHO has basically a free card to override the authority of governments. But you may be thinking, this is okie dokie fine because countries already have built-in clauses for emergencies that does the same thing. But two key differences, buddy. Uno, power comes from the foreign influence, means that it's quite similar to a literal invasion of the country's political landscape. And dos, power not only comes from one country, but all of the member states, which means it has basically the de facto controller of the world's government as long as the pandemic continues. This is unspeakably dangerous carrot to dangle in front of bad people, a situation that's a ticking time bomb with some real bad consequences. You guys heard of World War II? Yeah. By allowing the WHO to have greater control over the autonomy of people, it openly invites megalomaniacs with penchants for domination to enter the ring of WHO, creating leverage to benefit themselves alone. Even worse is the creation of a new political background in what will become the little bastion of health of the world. With millions of lives on the line, the future looks even grimmer for humanity. Thus, I am very proud to oppose.
Speaker spoke for 6 minutes and 3 seconds. We will now invite the third speaker of side proposition up to the podium to give his speech. All right, speaker will start in 3, 2, 1. So to begin my speech, the first thing I will do is outline my speech for the rest of the delegates and for the adjudicator watching back on this debate. Firstly, I will introduce the 3 points of clash in this debate that I've seen so far. The first is about a fast response versus a more planned out response. The second is about a country's duty versus a country's right. And the third is about the overall burden. Who protects the stakeholders the best? And then finally, I'll summarize my speech for the adjudicator. So let's start off with this first clash. Which is better to address a pandemic? Is it better to have a fast response or a more planned out response? Now, in the first sub of side opposition, they said that it was better to have a fast response, whereas on our side, in our first substantive, we said it was better to have a standardized response. Now, their rebuttal to this was that standardized response are not good all the time because a pandemic is a changing situation. And we completely understand that. We understand that a pandemic situation is a changing situation in which different changes need to be addressed. However, they overlook the fact that the WHO's enforcement of guidelines and other rules and other pandemic procedures on countries does not have to be absolute. While WHO can enforce things on countries, this enforcement does not have to be absolute. And as a result, WHO can take the time to plan stuff out better. And as a result, this may have a better response. What do I mean by this enforcement does not have to be absolute? I mean, WHO can go and tell countries, this is what you have to do, but not govern every single move that they make. Instead, the WHO can step in and say, all right, so for this country, these are the steps that they need to take to address the pandemic. In an ever-changing situation, of course, the WHO is not going to try and govern every single step of the way. That's simply not possible. We agree with that point. However, the WHO can still do a much better job by enforcing these laws in an unabsolute way. And that is because of the standardized response that we present. I would like to echo a sentiment that my first speaker brought up. A pandemic is a situation like no other. A pandemic is a virus that crosses borders, that hurts all people. It's not something that's unique to a country. So why should we allow a global issue to be handled by national and regional powers? A global issue should be handled by a global power because that is on what scale the issue is taking place. Of course, because the virus is crossing over countries, if one country does not handle the virus properly, it impacts all other countries. And because countries cannot be trusted to be accountable, which I will address later, a global response is the best. Next, I would like to talk about countries. Yes, before I move on to my second point of class, I'll take this point of information.
Do you believe the UN should take control of all countries' businesses because of their impact to the overall crisis of environment?
Even though I do agree that the crisis of climate change is extremely important, and I do think that there should be more measures put in place for climate change, I do not agree with the fact that climate change is a crisis that can be equated to a pandemic. A pandemic is a situation where things need to be dealt with quickly and on the spot. And as a result, by having more than one speaker in play, it creates disruption. Whereas the WHO is a centralized government, centralized sort of organization. That is the speaker that's in play that will be enforcing these changes. Whereas with climate change, the implications have a more long-lasting, more far-reaching effect. Now, I'd like to talk about my second point about countries' duties versus rights. Now, the second speaker of side opposition brought up the point that WHO might not be equal. And when I asked him the POI, would you prefer China or WHO dealing with Taiwan? He said they might be about equal. Now, I'm telling you very strongly that this simply is not true. Whereas WHO needs to think about global relations with all the member states, China by itself will be able to do all the exploitation that my second speaker talked about. And the second speaker side opposition failed to mention at all why the subtle inequality in WHO weighs more than the inequalities that we see in countries around the world today. And this is because, and the reason why these inequalities in countries is much greater is because countries have this autonomy in non-pandemic situations to do what they want. Whereas this would be extremely detrimental in a pandemic situation, and this is why WHO should take charge in that case. Now, we've been talking about a lot of rich countries so far, with people meddling in other people's issues. And these are issues that a lot of rich countries and a lot of MEDCs are going to be concerned by. However, the one point that wins us this debate, the one point that the opposition has refused to talk about is the most vulnerable stakeholder. And that is the poor countries, the LEDCs, who cannot cope with a virus this bad. Whereas COVID-19 has largely affected MEDCs and richer countries, and with a disease such as Ebola, with a more serious disease in poor country areas, the poor countries need the support and need the aid of WHO. As my second speaker said, if this disease was more prominent in poor countries, they would be exploited by richer countries, and this would be devastating for poor countries. Ultimately, our side protects this most vulnerable stakeholder the best, and as a result, that is the crux of why we should win this debate, because we protect this most vulnerable stakeholder the best, the poorest countries, and we ensure this equality. And as a result, I am so proud to propose. Thank you. Speaker spoke for 6 minutes and 4 seconds. We will now move on to the third speaker of side opposition. We will now invite you to make your speech. Speaker may speak when ready.
Hey, give a moment. Can you hear me?
Wait, before you begin your speech, Dylan, are you ready with your reply speech? Like, have you been like working on it?
Yes.
Okay, good. Just making sure. Yeah, we can all hear you.
You cannot hear me? Oh. Okay. During this entire debate, all three speakers in on-site proposition have failed to provide any mechanism in which they will ensure the WHO has the power to enforce its decisions, as well as to force countries to give them the information it needs to provide accurate information. But let's say that, so as a result, this makes it very hard for any of the substantives really to work, because, for example, in the first substantive, where they say that the WHO can impose a standardized solution, if countries were to simply ignore what the WHO says, then, well, it really wouldn't matter if they have this so-called big picture stuff and all that. But let's say that for some reason that the WHO has the power to enforce the decisions on countries. Well, you see, even then, the WHO will still lack full understanding of the intricacies of the situations in the 200 different countries around the world. Sorry, yes? Oh, wait. Oh, wait, I'm not, sorry, not. Meaning that a standardized solution will actually fail to account for all the variations in situations in different countries, and will likely fail to combat the virus effectively in all countries. Yes, your POI.
Does the speaker not realize that we've already addressed this point through suggesting non-absolute enforcement?
Yeah, well, I was about to get to that actually. By non-absolute enforcement, I assume that you basically mean that the WHO is going to tell countries that they can choose whether they want to do something or not, which the WHO suggests, which is kind of contradictory because you're essentially saying that they have the option to do whatever they want. So in that way, the WHO isn't exactly enforcing anything at all. Yeah. So now rebutting the second substantive on how they talked about the WHO being able to having healthcare as their only priority, whereas countries have other responsibilities. As explained earlier, country without managing the pandemic properly, countries economic activity is simply heavily devastated. So it is definitely in the country's interest to quickly get the pandemic under control so that they can continue economic activity. But even then, even if for some reason you're saying that the WHO is able to focus all its attention on healthcare without having to consider any other factors at play, this is precisely the point, because in order for a decision, the best decision to be made, it has to come from accounting for all the different aspects of a situation, rather than healthcare alone. Which is why when countries, such especially poorer countries, choose to prioritize the economic activity over lockdowns, it is actually, as weird as it sounds, it might actually be the best solution, because if they were to lock down the entire economies, all the poor people in the country will go from being poor to basically dying, because they simply do not have the necessities they need to continue living. And in those situations, the WHO imposing these lockdowns will actually be very harmful for these poor countries that proposition is trying so hard to protect. As for their third substantive about ensuring equality, they say that the WHO will be able to force rich countries to distribute their medical supplies equally. And well, let's assume that the WHO somehow has the power to do that. The reason why this still doesn't work is because we have to understand that rich have huge influence over the WHO, because fundamentally the WHO can only survive but because of the donations it receives from these rich countries. This means that if the WHO were to interfere with interests such as, no thank you, such as for example, mandating that rich countries do not force poor countries to be deprived of these medical supplies that they need, the rich countries will simply pull all their funding from the WHO, threatening the WHO's very existence. So the WHO, even if it technically has the power to do so, the WHO will never, ever, ever force rich countries to will never ever force rich countries to ensure equitable access for these medical supplies. So on to the, as the third speaker mentioned earlier, there are three questions in the debate. The first is about a faster response versus a more planned out response. We talked about how individual countries are better able to make decisions that suit the situations in their countries, and how this is actually much better than the WHO imposing a blanket strategy without considering all the different factors at play. And as for the second clash about duties and rights, we talked about how it is the country's right to to have autonomy over what happens in the country, and instead of being forced, its hands being forced by some international organization. As for equality, we talked about how the WHO actually is the opposite of equality, because the presence of rich countries funding its existence mean that it is biased against certain countries. Thank you for my and for all those reasons, I'm so proud to oppose.
Speaker spoke for 6 minutes and 13 seconds. We will now give both sides. Wait, do you guys want a 1 minute break before reply speeches, or do you want to get right into reply speeches?
Up to you guys, actually, if you want. But we have our reply speeches ready.
Dylan, have you checked the WhatsApp?
Yes, but he believes that side opposition will do the reply speech first.
Yeah.
Okay.
All right. Yeah, we can hop right into it then.
Okay. All right. 4 minutes speech for me. Everyone can hear me still, I believe.
3 minute
So I'll just
speech.
begin.
3 minute speech.
Oh, 3 minutes. Okay.
3
3 minute speech. All right. Okay. I'll start now. So we've acknowledged that this is a very tough debate in terms of balancing, the strengths and weaknesses of two different sides. But really, it comes down to one single thing, and who best, or which side best protects the people, because they're really the reason why the WHO is such a big deal. It's there to protect people, save lives, and make sure that nobody dies. I would like to point out one thing before I start on my reply speech, is that when I asked them of the POI about the environment, they gave a very interesting response in that they said, we prefer that pandemics be dealt fast and efficiently, which is very interesting because it's counterintuitive with what they said, because they said that they preferred more coordinated response over fast response. So technically, they kind of handed us a bone. So now why our side better protects the people? Our side wins because we actively increase the minds working on solving pandemics. We have multiple people from multiple countries actively trying what works and what doesn't. And what doesn't work, they'll shift to something else different. We actively give power to people who know local affairs and infrastructure better than the WHO can ever have. Even more, we allow for great development in several approaches in solving the pandemic. Just think about how Singapore had a different approach than Taiwan, and Taiwan came out on top. Taiwan did a really good job. In their world, that wouldn't be possible. They'll have to wait for the WHO to give them an order, or like they said, they're going to give them a non-order, which is like, well, do whatever you want while we plan. But the thing is, in their world, they fail at protecting people because while they are stuck in their, we're stuck in their safe offices planning out how best are we going to deal with this outbreak? What's the most ideal plan? What's the perfect plan? People are getting infected day by day. People are dying. People are getting sick. And they have no solution at all to why the WHO in the interim, why they're in the taking charge, will have a short-term approach to actually tackle this problem. So in the meantime, the world's just ruin. They don't really understand the nuances when it comes to short-term and long-term. And while they think the long-term is better, their short-term fails. And even if we take in the comparison for poor countries, we win too, because our faster response will result in lesser impact in richer countries, which means that more resources from the WHO can be focused on to poor countries and give them more support. In the end, everyone wins. It's a lot better. And that is why you must side with side opposition. Thank you.
Speaker spoke for 2 minutes and 58 seconds. We thank the speaker for his speech. We now invite the reply speaker of side proposition to come up and give the final speech. Speaker may speak when ready.
In the beginning of this debate, a burden was set. What team would be able to produce a more effective plan to the pandemic, the WHO or individual governments? And which side would provide the most benefits to the most people? Throughout this debate, side proposition argued 3 points that to fill this burden. We argued that the WHO would be able to provide a centralized, coordinated response to the pandemic, which would be more effective than individualized governments. Secondly, we argued that the WHO is the most able to respond to the pandemic because their only concern is public health. And lastly, we argued that the WHO is able to maintain equality, giving all people equal access to vaccines and personal protective gear. And side proposition through these points was the better side to address the key stakeholders. Because the key stakeholders were small countries who were susceptible to being bullied by larger countries. We proved that under the WHO that these countries would be able to have equal access to medical equipment. We argued that under the WHO that these individual countries would be able to have a more be able to have maintain better relations with other countries that's being maintained by a third party. Side opposition attempted multiple times to rebut our points. Their points were based on feasibility. They argued on a utopian basis that governments will consider public health over everything else, and that governments would simply be able to coordinate with other nations. They have they've simply only suggested alternatives than rather purely pointing out the flaws in our case. Side opposition dwelled on policy in this debate, but in principle, they never argued why our points were wrong. Therefore, in principle, side proposition would win this debate. Let's look at the two worlds from this speech. Side opposition's world. It's a world where there is no coordinated response between other countries regarding the pandemic. This is a chaotic world. This is a world where two countries who share a border, let's say the US and Mexico, who have toxic relationships, will not be able to come to a coordinated response that works together. This is a country where only the richest countries will have access to vaccines and personal protective gear. And this is where, and in this world, countries in Africa will maintain the virus. The virus will continue to spread in those countries and ultimately will continue to spread to the rest of the world. Whereas if we look at side proposition's world, this is a world where there's a coordinated response to a pandemic. This is a world where a third party would help mitigate issues. This is a world where where all countries that need certain supplies will be able to get it through a coordinated response. This is a world where economy is no longer the most important the most important aspect when controlling a pandemic. Instead, it's the health of the citizens, and the WHO is the only people that will provide this world. Thank you, and I am proud to propose.
Speaker spoke for 3 minutes and 5 seconds. We thank the speaker for his speech, and with that, the debate has been concluded.
All right.